Well, I'm Dr. Daniel Schneider, and we're here today at our office, and we're going to be performing a facelift and neck lift on our patient Brenda here today. And we wanted to just provide a little bit more information for people that are thinking about going on this plastic surgery journey, kind of documenting Brenda's experience from the time of the consultation to the surgery and after the surgery. And so we wanted to just start out by getting some background information from Brenda, basically why she wants to do it at this time, and what kind of questions other people might have similar to her.
Well, I am 48 years old. I have had multiple things done throughout the years of just, I think, age-related, addressing age-related issues. But I think at the beginning it was more cosmetic, but as I got older it became more age-related. And while although anything has been effective, it didn't seem to have the permanency that I was looking for long-term. And I don't really think it was maybe necessary for me personally before this point, but I'm really seeing at this point things that can't be addressed with the other options that I was using. So, just with the neck and lifting it up, it's amazing how it just falls all of a sudden. It's just like, it's not something that you notice, and then when you do, and you can put it off, but I felt like almost even as a preventative, long-term, also as much as cosmetic right now.
Absolutely. Yeah, I think it's an important point that a lot of people start seeing these age-related changes that occur, depending on their genetics and their sun exposure history and their skin quality, usually around the age of 35 to 40, and it's kind of like a slow decline from there. And so it's not unusual that people will have a facelift, neck lift, or another body procedure in that kind of 40, 50, 60-year-old age group. It's quite common.
I think when I was younger, and I would have thought about being at my age now, I think people had facelifts, and you had to earn it. You had to really have aged. My mother had one at 64, I think, and she really had to in her mind, I think she earned that cosmetic gift, sort of thing. But now we have much, we are given permission, I think, to address it at a time where you really get to still live the results versus having to wait till I'm practically in retirement to have the effects and the benefit of feeling and having a more what I would want to be age appropriate face.
Right. Yeah, I often tell my older patients that it's like you don't have to wait until you're 65, you've retired, or you're 70 to do a facelift, because oftentimes you'll get a better result earlier on because the skin quality is better, the facial volumes are still maintained, but as we get older and those elastin fibers start to deteriorate, the skin starts to stretch more, you're not going to get as good of a facelift as someone who might be in their earlier kind of age changes that they're seeing. And so common things that people will talk about is like the depth of the nasolabial crease here, the marionette line here, the jowl dropping below the jawline, and then certainly the neck. And so those are all areas that we're going to address today with a facelift and neck lift.
Mm-hmm. Also, I did have, Dr. Schneider already has done the blepharoplasty, which made an enormous, I think, as a baby step, because maybe not everybody's ready to go straight into something as what they perceive to be aggressive as a facelift, though I think what we're doing and what I understand, it's going to be a pretty easy process to get through. But you don't really know that. So you go into something like the blepharoplasty, and it changed my eyes completely. It opened up everything. And so I think maybe even seeing how easy that went, I barely had any downtime. It was so, and then you get almost immediate results. It was such a great experience that to have that experience first, I completely trust now the process of the next step, which I think is going to elevate and increase even more so the same effect.
Absolutely, yeah, that's a great point. So sometimes an introduction to plastic surgery would be something much simpler, like an eyelid surgery or what we call a blepharoplasty. So we've done that maybe 2 years ago or so, just an upper eyelid blepharoplasty to take away some of that loose skin in the upper eyelid. Then we came back and you did some threads, thinking that maybe we weren't quite ready for a facelift or a neck lift, so we introduced some threads for the mid face and the lower face. and then you've kind of realized that maybe it's
It was
just
like a
not
tease.
enough.
It was like
Yeah.
a tease.
It's a great introduction.
I wanted to, I'm like, this is so nice. I want you to go do the rest of it, yeah.
Absolutely, and so those procedures also were done similarly with just a little bit of oral sedation and local anesthesia. Today, we're gonna be employing those same methods. Some people wanna have, awake anesthesia, as we call it, versus total general anesthesia, where they're completely asleep. Oftentimes, the recovery period is a little bit faster, as long as they kind of know themselves, that they're okay with being awake during a procedure. You're certainly gonna see Brenda's journey today. She's gonna be very comfortable with this. We're gonna use a combination of oral medications to make her very relaxed. Then we're gonna use those same numbing medications called lidocaine to make the nerves all dull and numb. And then we'll do the procedure, and you'll see that whole transformation carried out today.
And this will be my third procedure under local.
Correct, yeah, you've had the eyelid surgery, the thread lift surgery, and then also some liposuction in the past.
Yeah,
So-
and that went so unbelievably, unexpectedly easy that I don't know why, unless somebody really was convinced they wanted to do general. The local has been very effective, and I didn't have any issues with it, and I feel like one of the things that people do get concerned about is sometimes the dangers, which I don't know if they're very significant or not, but you kind of hear them, that maybe it's more myth,
Right.
but we still sometimes attach it, I think, to doing general anesthesia in any capacity, not necessarily just for cosmetic. And so this was almost this freedom to do something that I really wanted to do, but without some of what I perceive to be, and I'm not, like I said, I don't know if that's a true statement, but it does feel like maybe I'm glad I'm doing the local.
Yeah, we offer both options here at our office, with anesthetist providing general anesthesia, but I would say more common than in the past, we're doing more and more under oral sedation with local anesthesia.
Mhm.